welcome to Living in the Lehigh Valley, where our focus is your health and wellness. I'm Brittany Sweeney.
And I'm Grover Silcox. On this episode, we'll learn about a group of neuropsychiatric disorders impacting young patients and their behavior.
Plus, meet the woman behind a noble cause in the Lehigh Valley, helping dreams come true.
And a local foundation is doing its part to support student athletes in the area with the help of an NFL linebacker.
But first up, did you know that a strep infection, like strep throat, can lead to neuropsychiatric conditions in children? The two related conditions can cause sudden and significant changes in a child's mental and behavioral health. We sat down with a mother who would stop nothing to figure out what was ailing her son and their doctor, who finally provided some answers.
So basically, you're on an island with 100 players, and the goal is to be the last one standing.
Like many 12-year-old boys, Matthew Blaine loves gaming.
So now I'm just going down here and I'm trying to get guns.
In fact, many of the Nazareth preteen's interests and behaviors are typical for a kid his age.
I like video games, soccer, hockey. I like watching TV. I like building forts. I like just going in my room and playing around with my Legos.
Very smart, very funny, silly. He just wants people to laugh all the time. He's very trusting, he's very honest. This was right before he first got his glasses.
But a few years ago, Matthew's mom, Nicole, noticed her oldest son acting not so typical for his age.
Everything started at around 5. We started noticing some things like the infections and little things he wasn't listening that well, so it wasn't really a big deal until he reached 4th grade. That's when I was getting phone calls from the school all the time for behaviors, and the separation anxiety was really bad.
I just get really mad sometimes, and it's hard to remember things a lot of the times, and I don't like it at all.
Matthew, what do you want for dinner, honey?
Chicken nuggets.
What do you want with it?
French fries.
French fries and chicken nuggets. I don't know what's in his control and what's out of his control. When he's not listening and stuff, sometimes he has no memory of what happened. He'll be crying, and there were times where he was spitting and just acting out of control, but he doesn't remember sometimes after it.
The mom of 3 knew something was off, so she set out to get some answers.
I got this one for Christmas.
He was diagnosed with ADHD, ODD, anxiety, social pragmatic communication disorder, and a tic disorder. He was on 4 or 5 different medications for that stuff, and nothing helped.
The behaviors persisted, but so did Nicole. She scoured the internet and found information about 2 neuropsychiatric disorders referred to as PANS and PANDAS.
And I read all of the symptoms, and I was like, well, this fits. So I had to go to the pediatrician and tell him that I wanted all the blood work. He argued with me about it, but he did eventually order it.
Matthew's blood work came back high for strep.
He would always get strep skin infections. He never actually got the strep throat. He would always get raw open infections on his skin.
It's like a rash, but I don't really feel it at all.
The family was finally getting some answers. A specialist Nicole found in Long Island diagnosed Matthew with PANDAS, then referred him to a doctor closer to the Lehigh Valley.
PANS, P-A-N-S, stands for Pediatric Acute Onset Neuropsychiatric Syndrome, and that can be caused by both viruses and bacteria. Some of the more common ones are mycoplasma, which is the germ that causes walking pneumonia, the flu, COVID, and strep. When the condition is triggered by strep, it's called PANDAS. So PANDAS is actually a subset of PANS. And PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorder Associated with Streptococcal Infection.
Dr. Angela Camasto is Matthew's pediatrician from the Woodlands Healing Research Center.
I focus on complex chronic medical problems like autism, PANS and PANDAS, ADHD, Lyme, Bartonella, tick-borne illnesses, that sort of thing.
The mission of the Quakertown nonprofit is to treat people with chronic medical illness, in addition to providing primary care for all ages.
We are similar to conventional medicine in that we do take insurance, but we are different in that we are looking for root causes of illness and using some integrative and holistic methods to try to heal the person's body.
Camasto says PANS and PANDAS are two types of inflammatory brain conditions that occur when an immune response gets misdirected. So instead of targeting the infection, it causes inflammation in the brain, which causes psychiatric conditions.
A typical PANS or PANDAS case will present with an abrupt onset of OCD or eating restriction, usually at the same time as an illness or shortly after, maybe even up to 1 to 2 months after. Some of the OCD behaviors to be aware of are excessive hand washing, sometimes an overwhelming sense of guilt and needing to confess even the smallest mistakes, compulsions to go through routines and rituals for simple activities of daily living. Sometimes the child may need constant reassurance, which would present with repeated questions over and over again, like, is the door locked? Is the meat cooked? That sort of thing.
The pediatrician says there are 3 criteria she uses to diagnose the conditions.
So the first criteria is, again, the abrupt onset of OCD or eating restriction. The second criteria, you have to have 2 other neuropsychiatric symptoms from a list of 7.
Those criteria can be found on websites like the Neuroimmune Foundation and the PANS and PANDAS Network.
And then the third requirement is that you're making sure that you rule out any other kind of medical or neurologic condition. So in a sense, this diagnosis is a diagnosis of exclusion. You always want to be considering other more severe or appropriate diagnoses for the situation.
This one I just got last weekend, and I built it together in 5 minutes.
In Matthew's case, he was able to receive a diagnosis in 2023 and has been undergoing treatment ever since.
Once we knew that it was PANDAS and he started getting treated for that, then they started going away.
I have found that patients respond best when we use a 3-pronged approach to treating PANS and PANDAS. The first approach is to take a very thorough history and do very comprehensive lab work to try to find the triggering infection. And once we find it, we treat it with appropriate antivirals or antibiotics. The second part is to try to decrease the immune response's inflammatory cascade. And we can do that with medications like NSAIDs, like ibuprofen or steroids. And I also use, being an integrative office, I use herbs and supplements like fish oil and curcumin. And then the third part is to treat the psychiatric symptoms. So we often encourage getting involved with therapy that's targeted specifically for OCD. And in some cases, psychiatric medicines like SSRIs are needed.
Saturday's gonna be 79 degrees. So what do you want to do?
Soccer in
We
the
could play
backyard.
soccer outside. He was started off on 2 antibiotics and he's on like a ton of supplements. He doesn't have the separation anxiety anymore. That was a big thing that completely disappeared. The rage, like he used to get really angry and like throw things, like that part has disappeared. Like that went away.
As symptoms disappear, the Blaine family says they are able to get back to a more normal life.
Field day is coming up, and the carnival, and the field trips.
I think it is very possible to get kids into remission for this. It is a lot of work and time.
I feel like I've been getting a lot better since I saw my first doctors, and I feel a lot better than I used to.
So interesting, but yet how confusing for parents whose child may be experiencing this, and where do the parents turn?
Yeah, it really can be confusing considering the limited resources on the topic. However, with the right treatment, doctors say the symptoms will eventually go away. Nicole said she has joined a few support groups since her son was diagnosed, and most of the parents of older patients say they've grown out of the symptoms of these conditions.
And now on to our next story here on Living in the Lehigh Valley. An area nonprofit makes dreams come true for children with serious chronic or terminal illnesses. The organization, named Dream Come True appropriately, serves children in the Valley exclusively. A parent, a family friend, even the child can contact the organization to begin the process of making a dream come to life. We visited one 5-year-old boy and his family to learn how his special dream came to life thanks to this local organization.
1 and 2 and 1, 2, 3.
Old MacDonald had a farm,
You.
E-I-E-I-O.
For a little guy, 5-year-old Cameron McMullen of Nazareth sure knows how to dream big.
I say he's my wild child. Like, don't let the wheelchair fool you. He does have his own personality. He is very funny and bright and just happy-go-lucky.
He's very vibrant. People know who he is everywhere we go. He has a smile on his face, and he honestly puts smiles on other people's faces.
Knock, knock.
Who's there?
Ho, ho, ho.
Ho, 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 ho.
It's Santa, of course.
Cameron was born with spina bifida. His condition left him paralyzed from the waist down. And yet, he never lets his challenges limit his hopes and dreams.
You're gonna be rock and roll theater in the park, right?
Okay.
You're gonna perform?
Yes.
One day, right?
Yes.
He wanted to go to Disney World with the whole family. And last year, a local organization helped make his dream come true.
Dream Come True is an organization that fulfills the dreams of children who are seriously, chronically, or terminally ill. We fulfill dreams of anything they would dream for. Number one dream is Disney World.
Of course, Cameron's dream included meeting Disney's foremost ambassador.
Mickey.
A friend referred Cameron and his family to Dream Come True and Rayanne Vasco, the group's executive director.
We connected with Rayanne and we discussed Cameron's dream of going to Disney.
You know, at first it was like, this doesn't seem real. We didn't really think it was gonna be possible, but then everything just kind of started rolling. Right? Yeah.
Well, they're a great family, and Cameron is very personable and a lot of fun. He was diagnosed with spina bifida, and he got to go to Disney and had a great time. Part of the dream package is they get a button that says how many family members, and they don't wait in line. You don't have to schedule times and run from this ride to that ride. You go right up there. Every employee is supposed to know from Disney, SeaWorld, Universal, that that child is special, take them in.
Dream Come True covered the cost of the entire trip.
They planned everything, the flights, where we stayed, took care of the passes.
The McMullens stayed at Give the Kids the World Village, an 89-acre resort for kids with critical illnesses, located just outside of Disney World.
The resort was like amazing for kids with special needs because everybody there was coming from an organization like Dream Come True and on a dream trip.
At Disney World, Cameron and his brothers loved the roller coasters, and one in particular.
The Slinky roller coaster, because it kept going up, down.
We had SeaWorld, we had 3 days in Disney, then 2 days in Universal. So it was jam-packed.
Medium. Low. Too slow.
Cameron's robust personality belies the challenges that he's faced in his 5 short years with multiple surgeries and hospital stays.
So Cameron has had 2 brain surgeries. One was to first try to alleviate the pressure in his brain because he has hydrocephalus. That one failed, so then now he has a shunt. He had to have tethered cord surgery to release the scar tissue on his spine. And he's on his 2nd surgery of having a ankle tendon release surgery. It's a lifetime of different surgeries to adjust.
We want to see these kids grow up, have a great life, but we also want to be able to provide and give them something that they can all remember and think back that during a dark time they had something fun that they wanted to do.
When we went on his dream, it was just like, that's all we were focused on, is just our family. We weren't worrying about the day-to-day things that we deal with. We were just enjoying the time of the trip. And that's like huge because the day-to-day things that we deal with a child with special needs, sometimes can be very stressful and tiring. For the whole family to just relax and enjoy a nice trip was awesome.
Dream Come True has fulfilled more than 1,300 dreams over 40 years for all kinds of kids and their families in the Lehigh Valley, with everything from Disney trips to celebrity meetups, from cruises to computer systems. And as for Cameron, well, he's got even more dreams to pursue, with a loving family to cheer him on.
Applause, please.
I think he'll thrive and be successful and overcome the obstacles because he has in the past. So going forward, our family will go through some obstacles as well with Cameron's needs, CHOP visits, surgeries, but we'll get through it, and we stick together, and with our love for each other, we can get through anything.
Joining us now in the studio is Rayanne Vasco, the Executive Director of Dream Come True. Rayanne, welcome.
Thank you. Thank you for having me.
Thanks so much for being here.
Thanks. I appreciate it.
It was a kick spending time with you and the McMullen family, and little Cameron is, you know, the life of the party.
Yes, he is. He's a spark plug.
He really is. So tell me, who founded, it was a businessman, an entrepreneur who founded Dream Come True,
Yes.
what, 41 years ago now?
Yes. It was a local businessman called Costas Kalogeropoulos, and he overheard something in the hotel. He was a vice president of, about a waitress who it was either her child or her nephew or niece who had this awful disease, and at that time it was a terminal disease, that wanted to go to Disney World. And being who he is, he's this big man with this big heart, and he thought, this would be a good idea if I sent them to Disney World, just come back and tell me. So he sent them his own money, and they came back, told them all about it, how wonderful it was, and he thought this would be a great idea. So he got his friends together, held a press conference, and 41 years later, here we are.
Wow.
Wonderful, wonderful. And so what's the age group of children that you serve through Dream Come True?
We begin at 4 years old because at 4 years old, they can tell us exactly what they want as a dream, and we go till their 18th birthday.
Wow, wow.
And, you know, like many nonprofits, your organization runs through the efforts of volunteers.
Oh, yes.
You started out as one, now you're the executive director.
Correct.
A part-time job. So tell us about the volunteers, the people who help.
Well, we have a lot of, a nice core of volunteers, and they can do anything from just our special events, or they get more involved in fulfilling the dreams, or we call it referral, where you go out and you interview the kids for the families, for what their dream would be. And one thing with us is you can be as busy as you want. So we'll have a meeting once a month with the list of kids that we're going to fulfill their dreams or interview them for a dream. And you can say, oh, I'm kind of busy. I don't think I can take any this month. And we're okay with that. We're very, flexible with your time as a volunteer.
Right.
And there's one volunteer in particular that kind of stands out. I know Grover mentioned her to me, and tell us about her.
Oh, she's amazing. She is 99 and a half years old. She's like my best buddy, Doe Levan, and she still helps me. She will do anything you ask, and if I don't keep her busy enough, she'll call and say, Rayanne, do you have something for me to do? She did a lot of our travel, because she's an experienced travel agent, and she is very good at it. She is just amazing. I would say from the time, she's been in Dream Come True longer than myself, and from that time on, she has volunteered for almost every single event we had. Wow. She's a go-getter, she gets results, and I just love her dearly.
Wow. Well, I think you're all amazing, and it's a great organization. We should say that it is a local Lehigh Valley organization. So not a national. You have to, the fundraising and everything.
It's all here.
All here.
We were born and raised here. We continue to be here. Like I said, we stay local. We're grassroots. And our biggest mission, besides doing the dreams, is to make sure that every dollar you give us is going to go to what we do. And that's fulfilling dreams, helping these kids who had dreams with us with college scholarships. And the one we don't like is, unfortunately, if you pass away, we will help the family with funeral expenses.
Wow. Such a special program, and special volunteers who get involved with it as well. Rayanne from Dream Come True, thank you so much for joining us.
Oh, thank you. Thank you for everything you've done for us. I really appreciate it.
And finally, today, thousands of student athletes across the Lehigh Valley receive a different kind of workout thanks to an Easton-based nonprofit. The group is called the Athlife Foundation, and the focus is helping students work out their minds and stretch their academic muscles.
The group recently held a special event for students with two-time Super Bowl champion Jonathan Casillas as the guest speaker. Our reporter, Megan Frank, caught up with Casillas and some student athletes.
There were definitely a lot of challenges as a student athlete, right? coming home late from games, having a test in the morning, being able to balance that schedule from game, from school, right? It's definitely hard.
Marvin Vinway is a junior and multi-sport athlete at Pocono Mountain West High School. He's also part of the AthLife program at his school and works closely with an AthLife academic athletic coach. Through grant funding, AthLife trains academic athletic coaches and stations them at area schools. The coach supports students during the school year. Marvin says he checks in with his academic coach each week.
But over time, she definitely showed me the importance of making sure you're in a positive mindset, checking in on you, right? Because as athletes, we don't have time to dwell down sometimes. So I feel like when we take time to really focus on what we're feeling, I think it's definitely important, right? To just talk to somebody about it also, right? Don't hold that in.
Offering a sounding board and someone who's keeping kids academically on track is the focus of the AthLife Foundation, which works with schools across the U.S. The group has academic coaches stationed in 11 high schools and 10 middle schools across the greater Lehigh Valley and the Poconos. More than a decade ago, two-time Super Bowl champion Jonathan Casillas participated in an AthLife program as a multi-sport athlete at New Brunswick High School in New Jersey.
I mean, it was great. It provided us for the after-school program, so we were in a place where we can do our homework before practice. SAT prep was huge, and the most important thing was community service.
Casillas is an alum of an AthLife-generated program called Play It Smart. He says the program kept him well-rounded. AthLife aims to get kids to think about life outside of sports, and that means keeping up their grades and participating in the community.
For me, the most vital thing, especially when you have somebody like myself who wants to give back, the community service part of it. Literally going into old folks' homes and playing games with them, and cancer wards and turkey drives, food drives. Like, the gamut is crazy how much stuff that I was able to do when I was in high school. They're probably not gonna pick you.
The retired NFL linebacker says he's even kept in touch with his academic athletic coach.
But she's like my second mom, though. So she is, and I tell these kids to have those people there, she's one of my people that I will call if I ever fall on my back and can't pull myself up. She's been that person. We have a definitely a very particular relationship, me and her. Like, my mom called her my second mom. I got candles at her daughter's bat mitzvahs. I am family.
AthLife says its academic athletic coaches are equal parts counselor, advisor, mentor, and overall champion for their students.
I grew up in a single house, right? My mom with 5 kids, and it was really hard for my mom to actually be engaged in my day-to-day stuff, like Mrs. Lazovic or these academic coaches can be. One thing that I told them that I am giving them advice for is that you need special people in your life that love you, care about you, and vice versa, and that you value the things that they say. You got to make sure you call on them people. At least have them in the reserve, because as athletes, as human beings, we're all going to go through adversity in our life. And most of the time, we'll be able to overcome it, but there's going to be times where you fail and you fall on your back and you cannot get up without the help of those people.
It's help that's supported by AthLife sponsors like St. Luke's University Health Network. St. Luke's offers sports performance coaches, athletic trainers, and physical therapists to the community. Director of Sports Medicine Relationships, Tim McGorry, says pairing all of that with academic support is crucial for student success.
As a health network, we're heavily involved in local athletics at the scholastic level. So, and part of the athletic experience is not just practices and games and trainings, it's the entire experience.
One of the things we have to do is acknowledge how important it is to invest in kids, especially in school-age kids. And we do that in a variety of ways. Investment in education is part of it, but we've also got to make sure that they have the supports to be successful inside and outside school. AthLife does an incredible job at helping students with mentorship programs and the like, especially student athletes, and it's an easy one to support, honestly.
She helps us do this thing called Sunday League, which we help special needs kids learn how to do different sports. It's definitely a humbling experience knowing that like our problems are minuscule compared to theirs. So I feel like they help me, like when we're lost a game, we go over there, we help them. It helps us make us think like, this is just a loss. Like they have to do harder things and wake up in the morning. Like, you know what I'm saying? It's hard for them to even walk sometimes, so.
I want to stay like with the sports community. So like when I go to college, I'll probably do something like physical therapy or something like that, or like being a physical therapist, or like just stay in the sports community. I've dealt with a shoulder injury for a while now, and I've stayed positive throughout the whole thing, right? Just being resilient and having a positive outlook on life.
The kids need support. The kids need people that believe in them and what they're doing, and they need support. So when they're ever questioning themselves or they ever feel like they've fallen down and they can't get up, AthLife have a staff that's supporting them to making sure they're not holding their hands, but they do have their hand out to make sure they pick them up. And I think AthLife is checking that box.
Just a wonderful message that they shared. And now we have the pleasure of being joined by our own Meg Frank. Meg, thank you so much for being here. What a wonderful message.
Yeah, it was really about resilience. Jonathan Casillas said, you're gonna fall in life, you've gotta get back up. And he also said for the kids to find people in their life who can support them, who can show up and be there for them for those really tough times. It's something, even as an adult, I was like, oh yeah, that's my village. Those are my people that I need when I'm having a hard time. So he spoke to the kids and adults too.
Makes total sense.
Meg, how do other schools get this program? Is it something the school board approves or parents advocate for?
So I would say both. The first step would be to contact AthLife. They have a website, athlifefoundation.org. They can actually really help to put the puzzle pieces together and get the ball rolling. To get a position like this, a school is going to probably need help. That might mean grant money. That might mean outside funding. And in some cases, a school will start by funding the position with a grant, and then they love it so much, the school board will vote to keep the program and incorporate a salary for the academic athletic coach.
That's great.
And is Casillas a local guy? Does he often come to these events? Do they have a lot of these events?
So first of all, he's amazing. He lives in New Jersey and he travels all around to speak to kids, to speak to student athletes. He said that through the AthLife program, which he's an alum of, he got the community service bug. And so way back when, he started volunteering when he was with AthLife. He continues to do that. He loves doing outreach work. He said he started doing Special Olympics in high school and volunteering, and he still, to this day, volunteers with Special Olympics.
Very cool. What a great guy. And if folks need more information about AthLife, is there a website they can go to?
Yes, they should go to athlifefoundation.org.
Wonderful. Megan Frank, as always, great to see you. Thank you so much for joining us.
Absolutely.
Well, that will do it for this episode of Living in the Lehigh Valley. For PBS 39, I'm Grover Silcox.
And I'm Brittany Sweeney, hoping you stay happy and healthy.